If you have back pain, nerve pain, maybe leg pain, there is an outpatient procedure that you can really get back to kind of living pain-free, hopefully. Dr. Abraham Rivera from the Florida Pain Relief Group is back to explain. Good morning. Welcome back.
Good morning.
So yeah, we're talking about pain kind of in the back and the leg. It's generally all connected, right?
Yes, it is.
So we're talking about spinal cord stimulation this morning, what is that?
You know, it's been around since, believe it or not, 1969.
Okay.
Every time I tell patients about it, they ask me, if this something space age, is there something new? I says, no, it's been around since man put a foot on the moon.
So why don't more people hear about it, you think?
I never ceases to amaze me. People don't hear much about it. Basically, we have the technology to take somebody to the operating room, put a needle on their back, and through the needle, instead of injecting, we feed a little wire, kind of like feeding, yes.
Okay.
Kind of like feeding wire through duct. And the wire touches the nerves of the back that go to the back and legs, and we take the needle out, and here this man comes out of the operating room with a wire on their back. We connect the wire to a pulse generator, a device about the size of a silver dollar. That machine generates an electrical current, a very tiny current, that blocks pain sensation and replaces what they were interpreting as pain with a pleasant sensation that overrides the pain.
Oh, wow. How many times do you typically have to do this?
We try this as an outpatient for the patient. We try it off the bat. And if they do well with it, we bring them back to the operating. Of course, we take that external wire out, but then we bring them back to the operating room, and this time we put the wire again in there, and we basically hide it, bury it under the skin. We give them a remote control, and in the old days, when I did this in the 80s, they were big and bulky. Nowadays, they're the size of an iPhone.
Okay, so the technology has changed a little while.
Oh, it's amazing.
Yeah.
There's an app now that they use on their phone. They press the app, and it turns on the thing, and they say, this feels wonderful. So the technology is out there to do that.
Well, and it's before we started the segment today, you actually said this is one of my favorite things to talk about. Why is that? Is it because the results are so, helpful for people?
People think it's something that is impossible to do, or is something like a space age. No, you can control pain using this in places that medicine really can't get to, like a leg, a phantom limb, people with chronic belly pain, people with headaches. It has an numerous amount of indications. Shingles pain. It's one of the most difficult pains to treat.
Oh, I've heard, nightmare stories about shingles, yeah.
Yes.
This can help with that?
Absolutely, absolutely. No, these devices are one of the most sophisticated things that we do in pain management. And I am very excited to be able to talk about it because most people don't know about it.
So who would qualify for this, or who would be a candidate to come in and have this done then?
Again, your best option is to go see a pain management specialist and explain if would this be an option for me, and the doctor will evaluate you and decide if that is the case.
I always like to talk about either downtime or kind of what patients should expect afterwards. What is that like? Anything people need to know there?
Once we put the device in, it takes about a week for the sutures to heal. And we tell the patients for the first 3 months, take it easy. We don't want those wires to move out. After 3 months, go for it.
And it's safe? This is a safe procedure to have done? Complications people need to know about or worry about? I mean, you hear the nervous system and going in there, and it makes you kind of nervous. But again, been going on for years.
We've been doing this since the 60s, like I told you, 1969. Very safe and dependable, very reliable procedure. There are several manufacturers that do it, and there's thousands of these procedures done all over the country. So it has an excellent track record.
You know, doctor, I can tell how much you love your job and how much you enjoy helping people, because at the end of the day, isn't this what it's about, is giving people their life back, their quality of life back? I mean, this can be really just, debilitating for people if they're struggling with pain. Absolutely.
This is one of those procedures that I compare it to a golfer. I played golf last weekend, and I probably hit one drive well. And the only reason I'm going back next weekend is if I can hit that ball again once. As doctors, few times we see a home runner, a patient that has been miserable for years and years. You do one of these procedures, and they get zero pain. That makes my day.
No, I can see that. Well, doctor, thank you so much again for being here this morning. If someone has questions, what would you suggest they do? What's the first step?
Call a pain management specialist.
Okay.
Our number is available right there, 1-844-KICK-PAIN.
Kick pain, easy enough, doctor. Thank you so much again. You can head to our website as well, which is tbmorningblend.com for the info as well.